Hi, I'm Dr. Zina Berry from Dental Leadership Academy. I'm back again and I want to talk to you a little bit about a tip in regards of the personalities you work with. And one in particular that helps us get the patient over the hump is they're working with the personality of your hygienist and understanding what does that really mean. So making sure I know my hygienist's habits and communication skills and making sure that she and I or he and I can communicate chairside in front of the patient so that the patient is getting everything they need in order to make a determination about their health and changing it. So making sure my hygienist and I have a personality that is synergistic or in alignment is something that happens outside of the operatory, not when we're in front of the patient. So some lunches and learn or some training mechanisms should happen in regards of sitting down and really understanding each other and how to honor each other, making sure that the patient is getting the best treatment possible. What does that look like? For example, one of my hygienists is very good at knowing exactly my style in regards of treatment planning. And I have taught my staff in regards of when I look at dental decay, we'll just take a tooth, number 5. It has dental decay. We know premolars are smaller teeth in the mouth. With all that being said, we have to determine what stage of this decay do I need to be able to treat this patient. And having the hygienist understand that too makes life a whole lot easier. So my hygienist knows that if the decay just resides in the enamel, hey, we know that's a resin. If the decay resides in the enamel and the dentin, and we can see it radiographically, and it's just pretty much a little bit into the dentin, hey, still a resin. However, if it becomes bigger and we see more of the decay headed towards the pulp, oh, that becomes an onlay. However, if we see decay on both sides and they're both going towards the pulp, we're probably looking at a crown. But making sure that your hygienist already knows that style of your treatment planning process makes it so much easier when you come in there with the patient because that person will already have down, your hygienist already have listed down for you, hey, I talked to this person about tooth number 5, and onlay has been something that I have talked to the patient about, the resin, the onlay, the crown, and I told the patient that you would come in and decide what's best for their treatment and why. Now with that landing scape that you just had presented to you, it's easy to step right into the operatory and start talking to the patient about, hey, what was found on the x-ray based on the hygienist and what's going to be the best treatment for them and why. Chances are your patients are going to want to get something done because they have been told not once by one person, not twice, but 3 times. A hygienist, she's already told them, she's already identified it. I come in as a doctor, I've told them, I've identified, and the 3rd time is when they finally make the decision to go ahead and execute and get the work done. Having that alignment with your teammate is so important. Understanding each other's style of communication and how we present the information to the patient is something that you have to align with your team with. I'm Dr. Zina Berry from Dental Leadership Academy. Go align your team.